I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, here to discuss the history of bipolar disease. When we refer to the disease of bipolar, probably it's better to refer to it as a bipolar disorder. The first indications that physicians and scientists were looking at bipolar disorder probably occurred in the 2nd century AD. In more contemporary psychotherapy, we began to see in the 1850s physicians and psychiatrists beginning to really study what bipolar disorder was at the time. They didn't have any type of medications to help with the disorder, and so they began to just notice it, track it, pay attention to it with patients over a period of time. And what they oftentimes saw was that bipolar disorder tended to come and go. And so they began to recognize that bipolar disorder has varying degrees of mood disturbance. Again, mania or the melancholy or the depression piece. In contemporary times, we began to use medications to assist in bipolar disorder as late as the late 40s, early 50s. And then certainly psychotherapy was still in its infancy at that time, and so it wasn't until the 60s, late 70s, we began to use a cognitive behavior approach to deal with the thinking and the mood in dealing with bipolar disorder. Bipolar disorder today can be detected in childhood. Historically, it was primarily seen in later adolescents, early adults, but today we're seeing that bipolar disorder can be diagnosed as early as childhood, oftentimes confused with attention deficit, hyperactivity, conduct disorder, or just childhood depression. I hope this information has been helpful regarding the history of bipolar disorder. From Tampa, Florida, I'm Dr. David Thomas.